History of pharmacy. Pharmacy, the art, practice, or profession of preparing, preserving, compounding, and dispensing medical drugs. Apothecary, a druggist or pharmacist. A drugstore of pharmacy. Pharmacy technician, sometimes known as pharmaceutical technician, is a healthcare provider who performs pharmacy-related functions, generally working under the direct supervision of a licensed pharmacist. Pharmacology, the study of drugs, their properties, uses, application, and effects. World history of pharmacy. In 3000 BC, Imhotep, the god of medicine, a priest and physician to ancient Egypt, Kemet, was the first to establish official medical healing practices. 1500 BC, the Papyrus Ebers, a Kemetic scroll, listed over 800 prescriptions using 700 herbal remedies. 400 BC, Hippocrates, a Greek physician, established practices of treating patients. His writings also established physician conduct, which included the Hippocratic Oath. History of pharmacy in the United States. Founded in 1820, the United States Pharmacopoeia created the standards for manufacturing drugs for more than 100 years. Philadelphia College of Pharmacy was founded in 1821. In 1825, the first periodical in the United States devoted to the art and science of pharmacy, the American Journal of Pharmacy, was published by Philadelphia College of Pharmacy. First published in 1833, Franklin Bach and George B. Wood compiled a comprehensive commentary on drugs, the dispensatory of the United States of America. William Proctor Jr. William Proctor Jr., the father of American pharmacy, was a professor at Philadelphia College of Pharmacy from 1846 to 1874. He and Daniel B. Smith helped founded the American Pharmaceutical Association in 1852. It is now called the American Pharmacists Association, APHA, the first established and largest professional association of pharmacists in the United States. The more than 50,000 members of APHA include practicing pharmacists, pharmaceutical scientists, pharmacy students, pharmacy technicians, and others interested in advancing the profession. John Maish. In 1868, John Maish introduced the idea of pharmaceutical board to be appointed by the governor of each state and established the term registered pharmacist. By 1878, 9 states had adopted pharmacy laws which licensed pharmacists. Every state now, of course, has a board of pharmacy which regulates the practice of pharmacy. In 1885, Joseph P. Remington published The Practice of Pharmacy, which soon became established as the standard text in the field. Later renamed Remington, The Science and Practice of Pharmacy, this comprehensive reference work remains widely used throughout the world. Quinine, extracted from the Quinachina tree bark, the first drug to successfully treat malaria, one of mankind's most deadly diseases. Cocaine, the first effective local anesthetic. Digitalis, the drug of the foxglove plant, which has been widely used in treating heart disease. Penicillin, the first antibiotic. Insulin, the hormone that lowers blood sugar in the treatment of diabetes, one of the great discoveries in medicine in the 20th century. Salicylic acid, a natural drug derived from the bark of the white willow tree, used by ancient Greeks to relieve pain, and the natural forerunner to the active ingredient in aspirin. Early drug regulations and laws. Food and Drug Act of 1906 prohibited interstate commerce in adulterated or misbranded food, drinks, and drugs. Government pre-approval or drugs is required. 1938, Food, Drug, and Cosmetic (FDC) Act. In response to the fatal poisoning of 107 people, primarily children, via an untested sulfamylinide concoction, this comprehensive law requires new drugs be shown to be safe before marketing. 1951, Durham-Humphrey Amendment. This law defines what drugs require a prescription by a licensed practitioner and requires them to include this legend on the label. Caution: federal law prohibits dispensing without a prescription. 1962, Kefauver-Harris Amendments. Requires drug manufacturers to provide proof of both safety and effectiveness before marketing the drug. 1970, Poison Prevention Packaging Act. Requires childproof packaging on all controlled and most prescription drugs dispensed by pharmacies. 1970, Controlled Substances Act, CSA. The CSA classifies drugs that may be easily abused and restricts their distribution. It is enforced by the Drug Enforcement Administration, DEA, within the Justice Department. Schedule 1. Schedule 1 drugs, substances, or chemicals are defined as drugs with no currently accepted medical use and a high potential for abuse. Schedule 1 drugs are the most dangerous drugs of all the drug schedules, with potentially severe psychological or physical dependence. Some examples of Schedule I drugs are heroin, lysergic acid diethylamide, LSD, marijuana or cannabis. 3,4 methylene dioxymethamphetamine, ecstasy, methaqualone, and peyote. Schedule II drugs, substances or chemicals, are defined as drugs with a high potential for abuse, with use potentially leading to severe psychological or physical dependence. These drugs are also considered dangerous. Some examples of Schedule II drugs are combination products with less than 15 milligrams of hydrocodone per dosage unit, Vicodin, cocaine, methamphetamine, methadone, hydromorphone, dilaudid, meperidine, Demerol, oxycodone, Oxycontin, fentanyl, Dexedrine, Adderall, and Ritalin. Schedule III drugs, substances or chemicals, are defined as drugs with a moderate to low potential for physical and psychological dependence. Schedule III drug abuse potential is less than Schedule I and Schedule II drugs, but more than Schedule IV. Some examples of Schedule III drugs are products containing less than 90 milligrams of codeine per dosage unit, Tylenol with codeine, ketamine, anabolic steroids, testosterone. Schedule IV drugs, or substances or chemicals, are defined as drugs with a low potential for abuse and low risk of dependence. Some examples of Schedule IV drugs are Xanax, Soma, Valium, Ativan, Talwin, Ambien, Tramadol. Schedule V drugs, substances or chemicals, are defined as drugs with lower potential for abuse than Schedule IV and consist of preparations containing limited quantities of certain narcotics. Schedule V drugs are generally used for antidiarrheal, antitussive, and analgesic purposes. Some examples of Schedule V drugs are cough preparations with less than 200 milligrams of codeine or per 100 milliliters, Robitussin AC, Lomotil, Motifen, Lyrica, Parapectolin. 1990 Omnibus Budget Reconciliation Act, OBRA. This act required pharmacists to offer counseling to Medicaid patients regarding medications, effectively putting the common practice into law. 1996 Health Insurance Portability and Accountability Act, HIPAA, provided broad and stringent regulations to protect patients' privacy. Types of pharmacy settings: community pharmacy, hospital pharmacy, clinical pharmacy, ambulatory care pharmacy, compounding pharmacy, internet pharmacy and mail order, veterinary pharmacy, nuclear pharmacy, military pharmacy, pharmacy informatics, specialty pharmacy.